Never
Is
heard of
Pentols
that.
kind of like the same thing they use like when you get dental work, like it makes you
It's
loopy, but
something
it makes you
new.
Like laughing gas. It's kind of like laughing gas,
yeah.
but it isn't. Like the
Yeah,
top
it's
has these
something
like
new.
stone things in it.
Mm-hmm.
Yeah.
Can I
Let
get
me
it? Can I
look it up.
purchase this just for a Friday night, or I'm just kidding?
Right?
No. But you
I'll
can
take
get your
2
doctor to prescribe it
boxes.
for you. Your doctor can prescribe it for you.
Oh wow, that's crazy.
But what would be a reason to get that? Like, you know what I
Probably
mean?
a
Like,
serious reason because
Going through
that's
like
pretty potent.
well, it's not okay. So the thing about this is like the second you stop doing it, it takes like 2 minutes, 5 minutes, and you're not stoned anymore.
oh, I
Like
got you.
it's for
Okay.
It's a
it's for,
temporary
solution
blocker,
for
like
for
pain
severe
blocker.
for severe
Okay.
acute pain. Like if
Yeah.
if somebody breaks their leg and they're in the ambulance, they'll give them a green whistle until they get to the hospital
Gotcha.
Yeah,
because they
Okay.
don't want you to
temporary
be in agony.
pain blocker. It's a temporary pain blocker. I don't know. Did I say that right?
I
Oh
know
my
this is
God.
serious, but I just had one more
You did.
meme I wasn't going to show, but you guys, we can talk about this situation, but I just had to put up this one more meme. It's not as good as the others, but we can still carry on this conversation.
They're actually using that now instead of giving the MP, so it doesn't cost as much money.
So it's halogenated ether is what it is.
Mm-hmm.
Because MP costs a lot of money to give to people because you gotta do the IV, you gotta run a bag, you gotta use a certain amount of the MP. So this is cheaper, this is easier and better and faster.
What is
What's
MP?
it?
I know you
Blocker.
can't probably say it. What it's like? Can you give me a hint? MP.
MP, morphine.
Oh, I got you. Okay. Thank you. Sorry. Yes.
I can't take morphine either.
Oh wow.
Well, I mean,
I can. I love it.
I don't know.
I
I
just don't
don't know
like
if I
it.
can medically. Yeah, I don't.
I hated it.
I had it when went in for my gallbladder.
Shit, that's the
and I had
best you
gallbladder
can
surgery.
get, man.
They said, "Do you want morphine?" I said, "Sure," because I was like, I was crying. I was like, "Oh God, my belly's gonna explode." And as soon as they put it in, because I'm not like I don't. I know I like to have a drink, but I've never done drugs in my life. But it made me
I
feel
don't
like
like
I
it.
wasn't. Yeah, it wasn't myself. And I
You lose
called
sense.
them in
You
to.
lose.
Yeah, it's like I don't.
You lose
This
sense of
doesn't feel
time.
okay.
You lose
Yeah,
sense of time.
I
Like
felt
you.
like I was like high or on some kind of substance or something, and I made them take me off of it, and they gave me an alternative. But yeah, I'm not a big fan of morphine.
So for me, like I lose sense of time. Like I would be literally in the middle of a conversation with like my mom. I would sleep, but then I would wake up and continue finishing that conversation. Like it was the weirdest fucking
Yeah.
thing. I did not like it at all.
Yeah, it's a very weird feeling.
It's
And I
so
think I'm
good.
just saying that
sorry.
Yeah, well, yeah.
I'm not gonna
That's what I'm
lie.
saying. Like, I don't even like to smoke, you know what, because I don't
Yeah.
like the feeling of it, and I feel like I'm not like myself or attached to my body. I feel like something else is going on.
And before everybody tries to run with it and say, "Oh, look at her, she likes MP." No, I don't. Of course, I like it when they give it to me, but I'm not going to go use it on a daily basis.
Right.
Y'all freaks
that's what I'm
out
saying.
there
You-
listening.
Knowing like your story, like I can, we're two different people. Like I like to drink. You used to.
I was an addict. Yeah,
have an addiction to other things.
21 years.
So
clean,
I can
though.
see why morphine wouldn't bother you as
Yeah,
much as like it would bother me, because it wasn't
Yeah.
like, oh, I'm drinking experience. It was like I don't even know if
I'm
in my own
lost.
skin.
I don't know what's going
Yeah, I
on.
was like-
Experience.
I was like, whoa, take me off. Like I can't do morphine. So they always have to give me like an alternative.
That's
Food,
why
here, be nice.
I've turned down a lot of things that the doctor wanted to give me because I know that I have an addicted personality because of my past. So I know what not to take and what to take. Like before a doctor wants to give me a medication, I'll ask them what it is. They say, "Well, try this." I say, "Okay, let me do my research." I'll either do it there or go home and do it. And if I feel like it's going to be okay, I'll take it. And if I don't like it, after I'm taking it for a while, I drop it right away. I wean myself off If you ever want to learn how to wing yourself off, I'll let you know. It's not nothing illegal. It's actually better than the doctor doing it. Yeah, you gotta be your advocate. You've got to.
Did you come clean on your own, or did you do like other resources or facilities?
I got put into 2 rehabs, and I did not get clean after that. The thing that got me clean was an OD.
Oh, wow.
Oh, wow.
Oh, fuck.
I didn't even know that.
Oh, wow. Really?
Yeah.
Wow.
So
I always hear this saying, like, people aren't going to change their ways until it, like, really affects them, like, in a bad way.
I have a disgusting fear of the dentist because when I was a kid, I had to get a lot of work done, and they gave me twilight sedation, but I remembered everything. I don't want to get into it, but fast forward to a couple years ago, I had to get an endoscopy done to check my stomach and my esophagus, and they told me I was getting twilight sedation, and I was like, so I'm not going to remember anything. They're like, no. Am I going to be asleep? He said, yes, you will be asleep. And I was like, okay. So I did it. They gave me the sedation, and I was like, okay. So they gave me this numbing spray, which was fucking potent. And I started coughing. I'm like, holy crap, that's strong. And then they're like, okay, we're going to start now. And I'm like, wait, aren't I supposed to be asleep, though? They completely ignored me, shoved it in my throat. And I'm telling you, man, the type of gag that I did was like the demons trying to escape. It was like this deep, like guttural, like gagging from the depths of your soul.
That's what happens, though.
Siren, stop.
That's what the
What is
Twilight
the siren? The joke's in my head right now.
No, it's from them sticking like tubes down my throat. From them sticking.
Yeah.
The jokes that just ran through my head.
Like
They did.
Twilight
Like, I can't even make it worse for Siren, but like,
I
I'm
know,
like, girl,
is
that should be a video.
Yeah, there's a lot of horror stories with twilight sedation, and if they don't give you a little bit extra, then you're gonna wake up in the middle of procedures. You're gonna be awake before that when they're starting. I mean, it's crazy.
Well, here's the thing. So I don't remember seeing anything, but I remember hearing everything, hearing and feeling everything.
Right.
And I remember him being, okay, this is polyp number 3. And then when he would cut it out of my stomach, it would feel like when you're going on a roller coaster and your stomach drops. Mm-hmm. It would feel like that. And then I remember that they ran out of collection of specimen containers. So they had to go find something. And then he stopped and went and made a phone call, or he answered a phone call, pardon me. And then when I saw him a week later, I was like, I'm not impressed right now. And he's like, well, why? I was like, you told me I was going to be sleeping. I was like, so tell me why I remember everything. Why you guys ignored me when I asked why I'm not asleep yet, and you just went ahead and shoved tubes down my throat before, like, you just completely ignored that. Completely ignored me. Why did you go answer a phone call and stay talking for like 10 minutes while I'm on a fucking bed? Well, not a bed, but the surgical table. I'm like, what the fuck happened here? Like, you told me I was going to be sleeping.
They thought you were passed out. They didn't think you were still can hear.
Yeah, that would have really.
I was talking.
Yeah.
I was talking to them. I was like, aren't I supposed to be sleeping? Like, hello?
Yeah, no kidding.
Fucking hell,
Wow.
man. So twilight sedation does not, like, it works for me, but I remember everything. And that's why I have, like, a lot of trauma from a dentist appointment that makes me now today, as an adult, terrified of the fucking dentist. Because I remember everything that happened during that twilight sedation. He put a thing in my mouth, this contraption that looked like some torture device, that keeps your mouth open, and left me for half an hour. And then came back, didn't even freeze my mouth, and started working on cavities. So I couldn't move because I was strapped down. So it was very fucking traumatic for me, and like
that just reminds me of that scene in oh my gosh, what's that movie? Oh, what are those movies where weird things happen? They just made a new
Final Destination.
Yeah,
the one where he was in the dentist office.
Yes. But the worst thing,
that just reminded me of that scene in that movie. Oh my god.
Mine was like that. No, Mob Boss, mine was like that because I had this contraption in my mouth holding it wide open. He's gone. I choked.
Exactly.
I started choking on my own spit. I inhaled it, and I couldn't sit up because I'm fucking strapped down. So I'm sitting
Oh
there
my
as a
God.
child, mind you, choking on my own spit, and
Oh,
freaking
that would
out.
be
I couldn't
fucking
close my mouth as
horrible.
well. Yeah,
Very
it was legitimately torture, and that's why I've got major issues now in regards to dentists.
Yeah, no,
I don't
can
blame
see
you
why.
because that
I'll
I
tell you
would.
something that we used to do when I worked at when I worked in the emergency room. There we had 3 different waiting areas. One was sick kids.
I look
I
terrible. That
screenshotted that.
forehead. That
Oh,
forehead
Girl,
is terrible.
girl, we're not arguing with like glam queens when we give birth to what the.
But
No.
that's Emma, like right after she came out of me.
That's a perfect.
And you were there
little
alone. This was when you were alone.
No, Bobby was there.
Okay.
But I just
Oh,
meant like
okay,
I
okay.
couldn't have like my mom and sister there, and we
Oh.
decided not to rotate people because the hospital was so far away from where I live. Like it was like a 2-hour drive.
that's so precious.
So cute.
I miss babies.
Makes it all worth it. Oh God!
She
Don't
came
start
out
with me,
first.
Cherry. Don't start with me.
Well,
You're
that's-
gonna give me
that's-
fucking baby fever.
I can't have babies anymore, but that's right before all the trauma happened. That's little Emma.
I can't have any more either, but I still get baby fever, even though I can't have any more. I always wanted
Girl,
more
if I
than
hear-
one. Mm-hmm.
If I hear babies crying, oh God, that's it for me. I immediately am like, oh my God.
Oh my God, I would have more babies and then just like give them up for adoption
Girl.
at 4 years old.
Your
Just
ovaries
kidding.
start screaming at you. They start screaming at you to have more babies when that happens.
I love babies.
Well, I had Autumn, but I had 5 miscarriages before her, and then she was
I had
born.
one miscarriage.
And then we tried some more because I always wanted like 5 kids. And then
Me too.
after my I better not say her name. After my daughter was born, then we tried again, and I had 4 more miscarriages. But then I had to,
Oh.
I had to have the partial hysterectomy.
Did they ever find out what was causing the miscarriages?
A lot of it was endometriosis.
Oh, you have that too. Okay.
Yeah, I have.
That's what
it
happened to
too.
me. So what happens in those situations is the baby can't grow anymore because of scar tissue and adhesions that it unalives because it can't grow anymore. That's
Right.
what happened to me. And then after that, I was like, I'm done with this shit. I want to get the laparoscopy and figure out if I actually do have it. I had the laparoscopy and I was pregnant either 2 days before or 2 days after the surgery. I got pregnant with my daughter immediately.
I had, after Emma, after like when I got that new OB or whatever. And you know what was funny is like this is my 3rd kid, and it was so traumatic. And my OB was like, "If you want more kids, we could probably do a VBAC." And I was like, "Absolutely
hell
not."
no.
I said, I
Mm-mm.
just want to like not have any more kids." And what she did was remove the tubes completely. It's a tubal removal. So it's not a they weren't tied or seared or whatever they call it, burn off. I don't
They
have
left your
tubes at all.
ovaries.
So yeah, and she said she does that now because it eliminates the chance of having like a tubal pregnancy, which is really smart.
Yes, because you
So-
still can get pregnant, bitch.
Yeah.
You still can get pregnant.
Well, I
You got them
can't.
ovaries.
Where's it going to go? It can't go through the tubes. I don't have any.
Well, no, I mean the ones that just have their tubes tied.
Oh, yeah. Yeah,
Those
right.
suckers can
There
get
is
through.
chances. Yeah, that's what I was saying.
Oh yeah,
And that's
they'll
why
get- those little
my new
suckers are
OB was
fast,
like,
and
yeah,
they'll
I
find a
do
way
it
to
this
get
way.
through.
They
Yeah,
will.
she said either there's a chance of pregnancy or tubal pregnancies, which are very dangerous. And so
Very
she just took them
dangerous.
both out. And that was probably the easiest surgery I've ever had, was a tubal removal. It was literally like 2 tiny stitches the size of like my pinky toenail.
Yeah, because they do it in form of like laparoscopy, so they only make
Yeah.
tiny little incisions. They stick
Very tiny.
skinny little tools in there and do all the work that way. It's so honestly that was
But,
my
like-
easiest surgery as well.
Yeah, but like, okay, so my sister came with me for that surgery because it was like it was an in and out one. Like they let me recover, but then I could
Yeah,
go home once I was okay.
Same.
And
same.
as soon as I came out, she's like, "Are you okay?" I said, I feel perfect. And then I started crying, and she goes, "What's wrong?" I said, "I can't have no more babies." Like,
Yeah.
so,
To realize,
even though I
kinda
made the
feel-
decision, like, I was like, "Oh my God,
Oh,
like,
how
what?
cute.
I can't
Effie.
have any more babies."
Thank
Did
you,
you see?
Effie.
Did you see your corgi? That was so cute.
I did. It was adorable. See, I really want to one day have a hysterectomy just to.
The process isn't bad.
No, it is. Yeah, well, no, Siren does have. You have a endometriosis, right? Yeah,
Right.
But
So-
that
That's
won't,
what I
but that
had.
won't get rid of it though.
yeah.
So that
won't
won't
get
always
rid
get
of
They
rid of
still
it,
won't
though.
do it because I
They
asked
will do
her
it.
if I
will
could
do
just
it,
have a
but-
hysterectomy, and she looked at me. She goes, "If you're traumatized by your C-section, there's no way." Rewind just 2 years later, my mom had cervical cancer, and they had to do a hysterectomy on her, and I was her POA, and I was in the hospital with her. I remember going live, so it was like, it was
Are you getting
2
your?
or 3
Are you
years
getting
ago.
Are you sticking up with your yearly pap test, tacos?
Oh, absolutely, 100%.
Okay, because if that runs in your family, you
No,
have to always get checked.
hers is not. Apparently, hers is not hereditary.
Oh. Okay.
Yeah, I don't know. Yeah,
I understand.
She
Yeah,
told
no,
us.
I understand.
I don't know the ins and outs of that, of how that works.
I can tell
but-
you. I can tell you.
Okay.
I can tell you. It's a strain of HPV, and I know that sounds. You're
Yeah,
not-
and
okay, so-
me and both my oldest daughters, we have a HPV vaccine. So, but she
Okay,
said it's
well-
not hereditary. I don't know how that works.
Okay, but hold on. HPV does not. The vaccination does not protect against all the strains. There's like a million different strains. Your mom probably had the strain that causes cancerous cells to grow on her cervix.
Yeah, she did have cancer. Yeah.
I'm surprised that she. So did she have to get a colposcopy?
Yes.
Where you. So she had to go in. They literally take
Yep.
something that looks like a giant pair of dog clippers and trim off, like cut off a piece of your cervix and send it away. Did she have
Yes.
to do that?
Yes.
Okay, so that's probably what caused.
She had a lot
her,
done. Yeah. They.
Yeah.
Yeah. But after the
Yes.
surgery, they called her back. Like, it wasn't even. I think it was like 2 weeks later, and they called her back and said that it was gone. Everything was gone, and that it was not hereditary. But she did actually was positive for I don't know what stage it was. Could be stage
Yeah,
1, but
It's
it's for cancer, and that's why
it's
they
an
had to take
HPV.
her in for.
It's caused from an HPV strain. Do you know that any woman that has ever had SMEX has some form of HPV? Did you guys know
Yeah.
that?
Yeah, I did.
I had the same thing.
Or
that your
you,
mom had.
or at
My
least you have like what do they call it? Like
Hey, Evan.
I can't
No,
remember what it's called.
everybody-
I'm not going to say
everyone
like a
that-
strain of it, but like
No, you do.
it doesn't.
Even-
You don't. Except you don't produce like symptoms or anything. But you
it's
have.
hard. Okay, so
Go ahead.
it's
You go.
hard to
You're the
explain.
nurse. No, I'm the nurse. But you go.
So I had that too. Mine came back with precancerous cells. And I was like, so what's happening here? Like what? It's really hard to explain and to understand, but it's not warts or herpes or anything like that. It's just,
Well, yeah, no.
I don't even know how to fucking explain it properly.
No, my mom literally had no symptoms. Like, as far as
No,
like
you don't. You don't.
external, like,
don't.
yeah, it's nothing like that. Yeah.
No, it's not. It's not. I would not consider it I would not consider it under the title of an STD because that's not exactly what it is.
Right.
It's just I can't fucking explain it. But
No, I kind of get what
they-
you're saying, but I don't know how to explain it either. Because my mom had it, but also like, I get what you're saying. Like, I think strain was a bad word. I'm trying to look for the right word of it. Of like, all women have like.
There's no way to really explain it because I don't know. I just don't know how to do it. But when I had to get a colposcopy done too. And by the way, ladies, it's one of the most painful experiences I've ever had in my life.
Yeah, I refused mine.
Dude, they had this big butch fucking German nurse come out and lay over top of my chest, and I'm like, what's what's going on? They're like,
I
"It's just so you
refused
don't
mine.
move."
I refused
And I'm
mine.
like-
They offered it to me, and then they said that they would run more tests. I said, I don't really want to do that. And they said, okay, we'll just run some more tests on you. And they said, we're not too concerned, so if you want to put it off, you can. That was like 2 or 3 years ago after I had Emma.
So your pap test came back with abnormal cells then?
No, everything's normal. They did it because of my mother. They want to do it because of my mom, but then my mom came back and said that they even wanted to do it on my daughter, and her.
What?
Yeah, after
Colposcopies?
yes.
But there's no need to do that. They just have to do regular pap tests.
Right.
And then do a
But they wanted to
What
do
the fuck?
further research because I told them that my mother had cervical cancer. That's why. But we refused it. Yeah, we refused it. And they said, okay, all we have to do is like do your regular pap smear and do blood work and stuff. And if everything comes back fine, you don't have to do it. So that's what happened. So yeah. Yeah, like a carrier. Yeah.
So the way
They were
that
concerned that we carried that whatever my mom went through, and I just refused tests because we're just too young. And me, I'm scared of it.
So the way that strain works is that it attacks the cervix and it causes abnormal cell formation. The doctor that I saw said that it could go away like a cold, like it would be gone in like a month, because it can't, what's the word? It can't like survive, I guess.
Right.
The body,
I was gonna say
like a healthy body eventually realizes that these abnormal cells are growing and it takes care of it. But sometimes
Right.
doing the colposcopy and just cutting that off, that ends the problem immediately.
Right. And you're right, Siren. They won't do it they don't do it on like healthy service or like women that don't like test positive for things. That's why me and my daughter got away with it.
Yeah, generally
they wanted
not.
to do it just because of my mother.
Oh, good night.
And I
Right.
said, hell no. Yeah.
Night cat. But yeah, no, because it'll just it'll eventually unalive itself and just go away because it can't. The healthy body, recognizes the abnormal cells, and the cells, our immune system cells, attack them and destroy them. So we don't usually have to. But if you're older, or you're very, very ill, or have an immune disorder, your body's not going to notice that, and that's when you get like full blown cervical cancer.
Right. And the thing is, like, I can't even tell you like how my mom found out because I don't remember. I just was like, because my mom's not like that kind of person. She doesn't have an immune problem. Like, she's very healthy. My mom doesn't drink, smoke, nothing. Like,
She probably just did her
doesn't
yearly
have
pap test.
multiple partners. Yeah, and she she just called us one day and said, "Look, I just found out I had cervical cancer." And I was like, "What the hell?"
You guys,
So what
you
the
guys
hell
want
is
to hear a
LeBron James?
funny story?
Sure.
You guys, sorry, I was driving, so I couldn't say anything sooner. Before my husband and I got married, I went to Planned Parenthood because we were broke, and I got my annual. And while I was there, the local college was doing a survey, trying to prove that adding, and survey is not the right word, sorry, but they were trying to prove how adding the human papillomavirus test to every woman's yearly, how important it was. And this is in the early years of testing for the HPV. And they would pay me $10 to add this test to my yearly. And I was like, sure, whatever. So they paid me my $10. I did my thing, and and they did their thing, and I forgot about it. A couple of months later, they called me back and said, we found some abnormal cells. We need you to come back in and do the colposcopy. I can't say that word right.
It's colposcopy.
Thank you.
Colposcopy.
Yeah. The little grain of sand. And they said, just take some Tylenol before it and you'll be fine. Yeah, no.
Yeah, okay. Yeah, okay.
Yeah.
What the fuck?
Then,
Tylenol doesn't touch that pain.
right?
Oh,
I
fuck
felt
no.
so sick and violated for days.
It hurts so fucking bad. Like, you guys have no idea.
So I wound up with HPV, and and it was the STD one that does cause cervical cancer, from my very first boyfriend, my very first sexual experience. And I carried it for a while, and then it stopped rearing its ugly head after I birthed my first child. It hitched a ride on the placenta.
Yep, I told you, the body eventually unalives it if you're healthy.
Yep.
But,
Yeah.
Aw.
Cute.
Ain't she cute?
Yeah.
It feels good to
love
talk about this,
that.
you guys. Thank you so much.
I know,
She's a
yeah.
little
we
bit
meant-
more
we meant
tan
this
on
to be like a petty
the face
live,
area,
but I
though.
love this for us.
The tan's not
Yeah, nurse.
even. The
Sorry.
tan's not even.
So
No,
I had
it's
like,
not even.
I'm not gonna bring that up. I was gonna say I had like some kind of like cyst on my hip. Everybody said that I didn't
Again?
wash.
wait, again? Wait.
No, I'm talking about
Oh.
when I shared pictures.
Oh.
But it came back. It wasn't like there was no MRSA or nothing. Like she said, I don't know what it was. She said a cyst. That's what's on my chart. I don't know. I was like, oh,
Yeah.
that fucking thing.
Probably
I gotta
just
go
some
back-
random fucking cyst.
I
used
gotta
to
go
send
back to
Siren
driving again,
fucking
you guys,
pictures.
but thank you for tonight. If you guys have to disconnect before I can get back on here. I
Of course.
really needed this to
It was
talk.
nice meeting you. No, I'm not gonna follow you on. I'll follow you.
Yeah,
think I
good.
followed you on
She's
my
a good
main account.
person, and I'm gonna start going live every night, Ari. So you're more than
Yay!
welcome to come in.
Also,
Yeah,
You wanna know?
Cool.
K Price is hitting on Siren. I can see it right now. And
You want to know the funniest shit? So there's been a men up here in this panel, you ladies. There's been a men up in here that
I
has
know.
not said a fucking
I
word.
know, Effie, what's your?
I know.
Effie, what's your
Effie's been
thing?
so
I don't know how to say that, but like the other people. But yeah, I had a lot of men that were like, I would go in their room and they would just pull out their pee pee at me, and I'm like, sit the fuck down, like. But I've been there for a long time, and also I really developed a bond with them. I've never been hit there or nothing, and I'm actually proud of that. But yeah, Lady Mob Boss. Now that I think about it, that's a place